new in a new profession, exploring the transition into practice of the first cohort of locally trained occupational therapists. I undertook this study as part of my master's study with Stellenbosch University in Cape Town under the supervision of Professor Lana Van Niekerk and Dr. Leanne Jacobs Nzuzi Kwabi. I received sponsorship for this master's program from Elizabeth Carlson in the UK. So I'm going to quickly take you through, to provide context to this presentation, I'm going to take you through the evolution of occupational therapy in Ghana. So occupational therapy dates back to the late 1960s, where the Ghana Health Service sponsored the training of some selected psychiatric nurses in occupational therapy in the UK. They returned to start occupational therapy in psychiatry. In the 1980s, psychiatry suffered underfunding and then low staff morale, and then most of these occupational therapists left the profession for overseas or to seek other works. So OT services continued to be rendered up until 2010, but was rendered by occupational therapy assistants who were trained on the job, whilst the occupational therapists were in service. And in 2010, the Ministry of Health collaborated with the University of Ghana to start occupational therapy education in the country. And the program curriculum was drawn in the same year. In 2012, a cohort of 20 students were admitted to start the program. It was a 4-year undergraduate program. And in 2016, 18 students graduated successfully and then started practicing at various settings across the country. So the aim of the study was to explore the experiences of the first cohort of locally trained occupational therapists during their transitioning from being a student to health professionals in the country. And the specific objectives were to explore the challenges and the facilitators of their transition, as well as the coping strategies they adopted to manage some of the challenges they encountered. I made use of an interpretive phenomenological approach within a qualitative paradigm. A purposive sample of 6 were recruited, 2 face-to-face in-depth interviews were conducted, a total data collection time of 15 hours. Field notes and the reflective diaries were also taken, and saturation was reached. And I adopted an interpretive, inductive, iterative, and thematic approach to data analysis. 4 main themes emerged, which were being new in a new profession, introducing occupational therapy into a medical model health system, personal and professional competencies, and the future is bright. So the theme, being new in a new profession, reflected participants' description of their transition, their personal capacities and personal competencies as a result of being new graduates in a profession that was new in the country. All the participants alluded to what they perceived as a disparity between their educational program content and the realities of practice. One student said, "They are 2 totally different words. What I learned in school seemed not to be applicable in the setting that I was in, and it appeared all that I did in school was theory, and now I am on the field and expected to do hands-on things, but I didn't know what to do." As there were no established occupational therapy services in the country, participants found the absence of occupational therapy specific supervision challenging. So some resorted to trial and error, and one participant stated, "There were no supervisors. I was only reporting to a physician assistant who didn't also know what occupational therapy is. I was just doing trial and error. If I try and it doesn't work, then I know that next time I don't have to take that path. The theme introducing occupational therapy into a medical model health system reflected participants' experiences with the system, the protocols, and then the structures of their workplaces, as well as the health system, and the relationship with other health professional staff as they strive to establish occupational therapy services in a new environment that is medical model biased. They discussed that the leadership of their health facilities were more interested in acute symptom relief services rather than rehabilitation. The participants believed that leadership preferences for medical model health care made it difficult to establish occupational therapy services in those health facilities. One participant said, "The management of my facility were only concerned about cure for patients. They didn't understand rehabilitation, and so they didn't know the members that made up a rehabilitation team. So they didn't see the need to give us a space." The team personal and professional development reflected the competency issues and then the experiences, and then the experiences of pursuing continued professional development avenues in order to enable them meet their professional expectations. One said, "Assessment was an issue. I hadn't seen an OT actually assessing a client fully for me to know that, okay, this is how it is done. Most of it was what I had read from books that I try to implement." Another stated, "I resorted to reading all the time. I had to read and read and read and also go online to search and watch YouTube videos." Another said, "I'm always interested in workshops and conferences because I feel like I don't know anything. So whenever I hear of workshops, I am interested." And the last theme, "The future is bright," reflected participants' hopeful aspirations and optimisms for the future of occupational therapy in the country, thus situating challenges they were experiencing as part of the process of establishing the profession itself for the first time in the country. Some participants stated, "The ultimate is that in spite of all the challenges, we are trying hard to be given the recognition we deserve in our health system. We should still move on and focus. One day, it will work for us." Another stated, "I expect occupational therapy in Ghana to be big, having a strong foundation of research that are relevant to our context, that can inform our practice here in Ghana. Evidence-based practice, I believe, is the foundation to succeed as a health profession." So there were many challenges in trying to practice occupational therapy in an environment that is new to the profession, and new graduate professional roles were not immediately obvious to them. They felt they were not adequately prepared, more so to practice independently without supervision. It is important for new graduates to recognize that professional identity development continues even after graduation, hence should endeavor to attend continuous professional development activities. Despite the varying challenges new graduates experience, a compelling sense of enthusiasm to establish the program in Ghana was evident and is an indication that the profession would thrive. So this study has been published with the Scandinavian Journal of Occupational Therapy, and then you can follow it up for more details. Thank you so much.